Welcome to Parent Squad. I'm Felicia Lawrence, and we have all heard this one, right, before from the kids. My tummy hurts. But how can you tell if it's anxiety, something that they ate, or they're just trying to get out of a test? And when is it time to see the doctor? Well, as adults, we think a lot about our gut health, but what about our kids? Here to help break all this down is Riley Children's Health pediatric gastroenterologist, Dr. Eric Andruski. Gastroenterologist, did I get it right?
You did.
Wonderful. So we're talking gut health. And what is the basics of gut health exactly?
Yeah, that's a great question. So the gut can refer from anywhere from our mouth all the way to our bottom. So it includes things like our food pipe or esophagus, the stomach, the small intestine, and the colon. These all serve a huge range of purposes in our body, from breaking down food to absorption of water and nutrients, to even the gut microbiome, which can help maintain our overall health.
Okay, I've heard a lot about a gut microbiome in the new year, so we'll get to that in just a second. And we know gut health is connected to the child's overall being, everything like you mentioned, from the mouth all the way to the bottom.
Yeah, so the gut serves a lot of purposes, not only the digestion like we talked about, but it's also the site of the second brain, or the enteric nervous system, which can have a huge impact on anxiety, stress, and mental health and well-being. So I think that's a factor that definitely plays into this.
So you're connecting the social emotional side to what's going on physically with our body too.
That's exactly right.
And as far as children, how would we see that show up, and how would we know like what's what, and how do we decipher?
It can be really tricky to tease that out. Sometimes you'll notice that certain food triggers may make symptoms worse, and that can often be a sign of irritable bowel syndrome or part of the gut-brain axis. Other times it may be worse with stress or anxiety. I think it's really important to realize that kids are not making these symptoms up. They're not doing it to get out of school. In fact, when I talk about stressors or anxiety, it can even be fun things like going to birthday parties, pizza parties, big events like that. But it can trigger pain, and it causes changes in those nerves and how they interact with our brain.
So what I hear you saying is that all of this is just really connected. So let's talk about diet and exercise for our kids, because you do want them to be aware of their health and fitness. However, you don't want them to be obsessed or have an unhealthy connection with their health and fitness at such a young age. So how do we make sure that the diet and the exercise is going well for gut health?
Yeah, I think the most important thing is to try to eat a broad range of healthy foods. And the more natural and less processed, usually the better. There's a lot of new evidence coming out that ultra-processed foods can be really bad for a variety of things, including increasing your risk of chronic diseases like inflammatory bowel disease, and even increasing your risk of cancer. We also know that a lot of those kids' foods really like Hot Takis and Cheetos, can really contribute to that brain-gut axis and contribute to belly pain, worsening reflux, and all of that. I encourage families to, not limit foods. There's no good food or bad food. It's everything in moderation, but to really aim for those natural foods with good fibers like fruits, vegetables, whole grains, natural dairy, meats. But that doesn't mean a little bit of cake every here and then is a bad thing.
Yeah, because we do love some Hot Takis and Cheetos. All right, and then what are some of the most common digestive disorders in kids? What are some things that you usually end up seeing?
So we see a lot of disorders of gut-brain interaction, like I already mentioned, and this can present as constipation, it can present as functional abdominal pain, cyclic vomiting syndrome, reflux, amongst many other things. We also see a lot of autoimmune processes, or where the body's immune system starts to attack itself, often the inside lining of the gut. That would include things like celiac disease, Crohn's disease, or ulcerative colitis. Then finally, not quite a food allergy, but on the allergy spectrum, eosinophilic esophagitis, or EOE, is becoming more common. It can lead to inflammation in the esophagus or the food tube, which can cause problems with swallowing, pain with swallowing, and even food getting stuck there, choking, gagging, all of those sorts of things.
And what is there like a particular age that some of these would show up that parents should be more aware of than other ages?
That's a great question. So they can really present at any age. I will say the most common for inflammatory bowel disease is oftentimes preteen, teenage years, but that does not mean that we don't have even babies in the hospital shortly after birth presenting with signs and symptoms of it.
Oh man.
Yeah, it can be pretty tricky, and symptoms may vary based on age too.
Is that curable, inflammatory bowel disease?
Crohn's disease and ulcerative colitis, unfortunately, are not curable and usually require lifelong treatment, but treatments are getting better every year, and there are more and more available.
Awesome. Okay, so we do hear a lot about food allergies, especially with this new age of children, and it seems like everyone is, these peanut allergies is just a really big deal, a really big thing. What's the difference with an allergy and a sensitivity?
Yeah, so allergies, when we use that word in medicine, at least, we generally refer to what's called an anaphylactic reaction, which is where multiple systems in the body can be affected, usually in a very short time frame, anywhere from seconds to minutes after eating the food. It can cause things like hives, swelling of the tongue, difficulty breathing, nausea, vomiting, and diarrhea, and you really need total food avoidance. Kids with true food allergies often have to carry EpiPens, and it can be a medical emergency necessitating calling 911 if your kid were to have an allergic reaction. Kind of in the middle, we have celiac disease or eosinophilic esophagitis, where over the long term, eating these foods can cause inflammation and damage to the inside lining of the GI tract, but it's not an immediate reaction and not life-threatening if you have one ingestion. Then at the bottom end of the spectrum are more food sensitivities, which probably are the most common. Kids may have a repeat reaction like bloating, abdominal pain, even diarrhea or constipation with every ingestion of a food. We typically recommend avoidance, although in some cases, like lactose intolerance, there are treatments like lactate or enzyme replacement.
So are you seeing more of the allergies versus the sensitivities, or what do things look like lately?
Yeah, for the most part, everything is increasing. There is one bright spot. Peanut allergy has certainly gone down over about the past decade. We started recommending introduction of peanut products at a younger age to develop tolerance of the immune system, and that seems to be working with a decrease. Otherwise, food allergies and eosinophilic esophagitis, both of them are definitely increasing in terms of prevalence in kids in the United States. Why that is, we're not exactly sure. Some people speculate that it's the hygiene hypothesis, meaning that kids grow up in this ultra clean environment these days, and their immune system does not have time to train itself to get used to foreign things or foreign proteins. For example, we know farming children have less incidence of allergies than other children who might live in cities do. Other things that might affect it are certain acid blocking medications, the Western very processed diet, and exposure to antibiotics at a really early age.
And what was the word, because you say it so well and so fast,
Eosinophilic esophagitis, or EOE.
Okay, and what is that particular and specifically?
So that is related to asthma, seasonal allergies, food allergies, and eczema. And there is a specific kind of white blood cell called eosinophil that causes inflammation in the food tube, and it can make food difficult to swallow, can cause vomiting, especially in the littlest of kids, as well as some abdominal pain.
For my toddler, I know they were saying that an allergy might not show up right away. It might show up after they have ingested the food a few times. Can that stand true for an older child as well, or you typically see it, is that a rule for the younger children?
Certainly for things like celiac disease or eosinophilic esophagitis, it can present at any time. So intolerance to gluten, or a protein that's found in a lot of breads and cereals, can develop even well into the teenage years with onset of diarrhea, abdominal pain, even sometimes brain fog or rashes in the body.
Okay. Probiotics and prebiotics. It's something I feel like we talk a lot about as adults, maybe not so much for as kids. I know we try to get everyone to eat yogurt, but how important should that be, and should that be a regular part of our kids' diets as well?
That's a great question. We are still learning so much about pre and probiotics, with probiotics being these good, healthy kinds of fiber that serve as food for the bacteria that live in our gut, whereas probiotics are actually bacteria themselves we're putting into the tummy. In terms of the data, we're not sure. You know, every strain is a little bit different, and complicating things even more, these are regulated as food supplements rather than medicines. So what a label says may not exactly be what is in the probiotic in terms of the type of bacteria or the number. We do know that very certain bacteria or very certain probiotics may have some good benefit for certain conditions, like stopping very rapid onset diarrhea sooner, preventing diarrhea associated with antibiotics, colic in breastfed but not bottle-fed babies, or even functional abdominal pain.
Okay. And I imagine, is it more so up to the doctor? We should check in with our doctor if we end up wanting to try these supplements out, or is it generally not recommended for children to take supplements like that?
Yeah, I would check in with your doctor, again, just because not every probiotic is created the same, and we know that specific types will benefit specific disease processes. In general, we think they're pretty safe, with the exception of kids who are at really high risk for infection. So like if you have a permanent indwelling IV, like a central line, or you're immunocompromised for some reason, we may recommend not taking them. Otherwise, the safety profile is pretty good. So if it's something you want to try, I think it's reasonable.
Okay. Well, clearly there is a lot that goes into your child's gut health, and you know your child the best. So definitely reach out to a doctor if it's something you feel like you should do. Dr. Andruski, thank you for being here.
Thank you so much. I appreciate it.
We have a lot to think about here, and we have a lot more info on Riley Children's Health. Just head to WTHR.com/Parent Squad. Still ahead, we are talking about gratitude and how to get the kids involved in giving back.